I have his current payslip, where the gentleman, his name is Dr. Stephen Rogo Mogusu, who was working for, I think it's KCB Kisi, and his net salary was 653,498.35 cents. Now, in the payslip, it clearly indicates that there are arrears, which shows that there is money that he had not been paid. It shows that there was even arrears on his rental house, arrears on commuter allowance. It says arrears on non-practicing allowances, and then arrears on emergency call. His entire gross earning was 869,000 Kenya shillings. The reason why we sought at least 7 days, for us to be able to come to terms with what exactly is happening is because it is very difficult to be able to render judgment when you are looking on only one side of the coin. The Ministry of Health has sent me today the gentleman's payslip for November. So for us to be able to bring all these people on board so that we can discuss and be honest enough and say, what is it that you have not been paid?
And with due respect, Senator,
because
payslip or not, allow me to interject, sir. Payslip or not, he's no more. His family has lost a loved one.
So
at bottom line, he died in the line of duty. So we could split hairs here over whether or not he earned the salary. The KMPD released that statement, but he is no more. He's dead.
Very, very unfortunate, and we should not lose any medical practitioner. We should not lose any Kenyan in terms of COVID. We should be ready to be able to defend the rights of every medical officer, and that is the reason why we as an oversight body are willing and ready to take to task the Ministry of Health, the county governments, but we also want to be able to be faced with facts. We don't want a situation whereby we're being presented with things. The kind of information that we've received now, if this information is a forgery, then of course we'll take the Ministry of Health to task. The challenge we have at the moment, and which is what we want to be able to demystify, is the issues raised by the doctors. We spoke passionately to the doctors, and we requested them, to give us a smaller moratorium so that we can, on the strike, so that we can be able to sit down, call these people. We've invited governors on their own capacity as governors, as CEOs of counties, knowing that counties' health services have been devolved, so that we can be able to clarify these matters.
And Senator, as I bring in
we don't want to point fingers. Our position is very clear. Let me finish this one, Nuna. Our position is very clear. The doctors, the clinical officers, the nurses must be given what it is rightfully theirs.
But you did not respond to my question, sir.
A CBA, which question?
The question is, you managed to get that temporary reprieve on the doctors, but the nurses and clinical officers have begun their strike. Senate, healthcare is a devolved function. Why didn't you manage to get some resolution of sorts with these officers as well?
Very good question, Sophia. We've got to start from somewhere. The people who we called, I take full responsibility as a member of the Senate Health Committee that we have been overwhelmed by cancer scandals, we've been overwhelmed by COVID, and maybe we overlooked the issue of clinical officers. But when the doctors issued the strike, it became a wake-up call to us. And I'm very grateful to the union Secretary General, and also there was a lady called Dr. Godi. We're very grateful because they gave us an ear. They allowed us an opportunity to be able to call these people. SRC, they raised issues on SRC.
Okay.
I've already called several governors, including my own governor in Narok, and asked, the doctors are demanding to be given their own private isolation center, their own place that they can be able to be treated. And the governor told me that in Narok County, he already has a place where the doctors are treated separately.
All right, Senator.
And when they fall sick, they are taken into the hospital.
Right, and I'll come to you, SG. I know you wanted to respond on the issue of that payslip that has been raised by Senator Olekina. We have now via phone the Ministry of Health, CS Mutahi Kagwe, joining us live. Thank you, sir, for your time. We have an admission on record just a moment ago. I don't know if you managed to hear that, but Member of Parliament, or the Senator Olekina, saying that they perhaps overlooked the issue of the clinical workers and nurses with their strikes commencing today. As Minister of Health, would you say that is the same case when it comes to the helm? Hello? Can you hear me, Minister? CS Mutahi? All right. I appears not to have him yet. While we have him ready, we will get speaking to him and hear his view at the national level dealing with this crisis. But SG, Panyako, you wanted to say something in response to what the Senator said on that payslip.
I don't know whether Senator Olekina has ever worked in public service. But if he has ever worked in public service, he should rightly look at that payslip once again. Payslips are normally released before salary hits your account. That payslip has been released by the Ministry of Health to try to clear their face. That is salary in arrears. I was even wondering when he was talking about 600,000, I was wondering, a young doctor like that one, where can he get a salary of 600,000? That is a payslip of November, which is being paid in arrears after this doctor has died. This doctor has died before seeing that money in his bank account. That must be appreciated. That payslip is not a reflection of money in the bank. It is money in arrears, which has been manufactured by whoever has manufactured it to try to mislead the members of the public. That cannot be allowed.
All right. Do we have the minister with us yet?
Sophia, before the minister comes on board.
Yes, briefly, sir.
I just want to assure the Secretary General for the clinical officers that this indeed is evidence. And I've already made it very clear that even the documents indicated here, even the line items in the spreadsheet, are indicating that they are arrears, that they have not been paid. Okay, so it actually makes the case of that doctor much stronger, that they were not paid this money, because the basic salary is around 49,000 shillings. Yeah. But when you look at the gross salary, it is 869,000 shillings. So the question that we are going to be asking so that we can find solution is why is it that this money is in arrears? And why is it that this payslip has been released after this fellow has died? Exactly. Those are the things that we are going to be able to help. And I just want the clinical officer to know that we are the ombudspersons of the clinical officers, the doctors, right. And we are here to ensure that they get what is rightfully theirs.
All right, thank you for that. CS Mutahi Kagwe, Health Cabinet Secretary. I hope you can hear me now. If so, there is a statement and a payslip that Senator Olekina says he has received from the ministry. This is of the news of the death of yet another doctor. But as you touch on that, perhaps, why is it we have not seen interventions on the strike that now has begun on the nurses and the clinical workers?
Thank you very much, Sophia. First and foremost, let me send my condolences to the family of the late doctor, because it is always a very sad thing when we lose not just a doctor, a front warrior, a healthcare worker, but also one of our family. Whenever we lose anybody, whether a doctor, a teacher,
I can't hear.
You know, it is one person too many. That is number one. And number two, I think we are concentrating on the wrong thing, because, you know, we don't want to look like we are taking advantage of somebody's death to try and to our well-being. The fact that if somebody has not been paid or has been paid is a backlog of salaries or otherwise, is an issue, but not the main point right now. Right now, it is our time to give condolences to the family of the young man. He has a mom, he has a dad. Let's not take a sucker out of the death of a young Kenyan.
But Waziri, this death is setting a tone for this conversation where the health workers are feeling abandoned. In fact, the SG earlier said we have been neglected by government. We are on our own, telling Kenyans they are on their own. So perhaps briefly, what do you tell Kenyans at home watching all of this play out, and some that have to go seek medical services and find no one?
You know, Sophia, this is a difficult time for the entire country. COVID-19 is not something that anybody foresaw anywhere on earth. It is something that we all have to bear difficulty, trying times, and I can tell you for a fact, we are not even over it yet. We have to brace ourselves for even more difficult times ahead. It is not a Kenyan phenomenon. It is a global phenomenon. And all I can say is that as a government, we will do everything, and we have continued to try to do everything within our power. We are not like the proverbial burying our heads in the ground and assuming everything is okay around us. Everything is not okay.
All right. Minister.
Can you hear me?
Yes, we can hear you. We have barely...
Listen, everything is not okay. Let's start from there. Everything is not fine.
It is not, and that is why we're having this conversation, sir.
I understand what you're saying, but I also want Kenyans. I don't want to lie to Kenyans. We are not in lying mode where you tell Kenyans everything is fine, no other doctor is going to die, no other Kenyan is going to die, a teacher is not going to die, a farmer is not going to die, and a reporter is not going to die. What I'm telling you, and I want, because this is great that we are talking to Kenyans. Can you hear me?
Sir.
We are talking to all Kenyans. And we are telling Kenyans, every day, the number of people in the United States who are losing their lives are probably more than Kenya has lost since we started COVID.
All right, sir.
This is not a usual situation. But I'll tell you something else too. The unity that the health workers have shown in our nation,
yes,
this is up till now, is absolutely and totally admirable.
And Waziri, unfortunately, I have to cut you short. We are pressed for time and have to take a commercial break at this point. Hopefully, we will be able to link up with you as we continue with this conversation a little later right here on KTN Prime. But thank you for making time to comment on the subject. Our guests continue to stay with us. SG, Kenya National Union of Nurses, Seth Panyako, as well as Senator Ledamo Lekina, who's a member of the Health Senate Committee. Hopefully, we'll also have CS Mutahi Kagwe after we run a few stories following this short break. Coming up is my colleague Brian George Otieno. He'll be bringing us a business update and talking to us more about that JKIA Express train, amongst other stories, and later on some sports news. We hope you can stay with us right here on KTN Prime.